Today we have Brian Hendrickson, who is a nurse practitioner on the acute care floor, to tell us about his role and how he helps patients. Thank you so much for joining us today, Brian.
Happy to be here. Thanks.
So tell us what a nurse practitioner is, because I'm not sure everyone knows what that is, especially when compared to a doctor.
Sure. Yeah. And there is some confusion. So that makes a lot of sense. We fill a role as a provider. So for instance, I write prescriptions, I see patients, I create care plans, typically with a multidisciplinary care team, including nurses, physical therapists, doctors as well, nurse practitioners, and physician's assistants who do pretty much the same role as a nurse practitioner, except from the medical field. They have a medical-based training rather than a nursing-based training.
Okay.
Yeah.
And how long have you been in this role?
So let's see, I guess I've been a nurse practitioner for about 6 years now. And in my current position in a medical ICU for going on 4 years.
Okay.
Yeah.
What is it that made you want to be in that role? Had you been in a different role and didn't feel you had enough? So I think of myself. I was an assistant to a counselor for a long time, and I just didn't feel like I was giving enough. So I wanted to be that next level. So can you describe that for us?
Yeah, absolutely. So I guess starting with my nursing training, I became a nurse first and gravitated towards critical care, working in ICUs or emergency rooms, that sort of setting. I was just pretty well suited towards that and more interested in that than other parts of nursing. But there are many, many avenues in nursing that you can pursue for sure. And worked in a pretty high acuity critical care setting already, and knew that I had more to offer and more that I could do. And so went ahead and got my master's degree as an acute care nurse practitioner. Had always worked in cardiovascular surgery as an ICU nurse. I'd worked in other ICUs, but that was my primary role. But then when I started looking for jobs as a nurse practitioner, got a role in the medical ICU and found out just how different medical ICU is from post-surgical ICU.
Yeah.
So yeah, feel really blessed to be where I am.
With that practitioner piece, are you having to do a residency like a doctor? And how do you get your experience outside of just being a nurse?
Sure. There are residency and fellowship programs for folks who get into who become nurse practitioners and want to fulfill a particular role. I had a pretty good background in critical care and a pretty good understanding of really high acuity critical care. So it didn't feel like that was necessary for my, I guess, job search or job satisfaction. And so was lucky enough to find, the position that I'm in. I get to do procedures, I get to prescribe medications and take care of people who are desperately ill.
What is it about that job that has driven you to it? Because I know for myself, I can't even handle blood, let alone a critical situation. So what is it that drives you and motivates you in that field?
Yeah. Well, I think that people who are in critical care tend to self-select. You have to know yourself first and know what you're comfortable with and know what you like to do. And I tended to, even before nursing, even when I chose nursing as a career, I knew that I could be fairly good under pressure and be kind of a calming influence when you have tough situations. And so I think that's part of what drove me to emergency medicine and critical care medicine. Also have to be ready to just sort of jump in and roll up your sleeves and take things as they come at you, because you never know when somebody's going to come through the door, what the issue might be. So you have to be pretty flexible and okay with that. Some of that can be trained, but I think a lot of it is just sort of personality and what you're comfortable with. One of the great advantages, though, is when you're done with your shift, you're done with your shift. There's no outpatient follow-up. There's no planning. There's no, unless you have research projects or things like that, my responsibilities are done when I leave. And that's a great luxury. So, there are pluses and minuses to any job. And those are some of the pluses and minuses to mine.
Yeah. Tell me a little bit more about your education. I know we talked about getting your master's, but
Mhm.
did you have, did you start as a CNA and LPN? How did that work to get in
Yeah,
that role?
sure. I have kind of a non-traditional path to this job. And so I'm happy to share that with you.
Yeah.
So this is a second career for me. I retrained kind of later in life after being an architect for better than 15 years. Um, and Back in 2010, when the Great Recession hit, it became harder and harder to find projects, and it seemed as though myself with a young family, the economy was not very stable, particularly in anything regarding building or design. And so I took a big step back and decided to retrain, and that's when I became a nurse. I went through an accelerated program since I already had a degree. So, kind of a shortened program. I took some prerequisites at a community college. I hadn't had a life science since I was in high school. So, it was a big change, but got ready to apply to accelerated nursing programs that could be completed in 2 years. Did that, became a nurse. Like I said, gravitated towards the ICU or critical care. And then after landing in a high acuity ICU job, worked nights and then went back and got my master's degree, as I continued to work full time as an ICU nurse. And then here I am.
So that accelerated degree gave you your bachelor's then, or did you not need that since you had the
Yeah,
degree?
yeah. Gave me a bachelor's. So I have two bachelor's degrees and a master's degree.
Okay.
Uh, and there's lots of different ways to cut it too as you get into nursing. You don't have to have a bachelor's degree to become a nurse. You can be an associate degree nurse. And I think there are even some licensed professional nurse programs. They've been talking about doing away with those for a long time, but I think that they do still graduate some licensed professional nurses. And that's one of the nice things about nursing is you can enter at lots of different levels and decide where you want to stop or how far you want to keep going.
Right. Would you say um, there are many technical skills needed for the role that you're in now, or?
Yeah, there are. Technology is always changing. Um, Electronic medical records, those types of systems are always changing. Uh, I use an ultrasound machine quite often. And so, you get trained on those, how to manipulate and use a ventilator, those types of things. We do procedures as well at the bedside, emergent procedures. So being able to intubate with a video glide scope, um, bronchoscopies, all those types of things are available. And, there are also very specialized roles in critical care and just sort of in medicine in general. So if you're kind of gear driven or you like a particular type of technology, then you can sort of specialize in that.
Okay. What about soft skills? If a student is thinking this is a career path they want, um, I would sure think you wouldn't want somebody super abrasive and loud to be talking to patients.
Right. Well, there's all kinds of communication styles for sure. And the ICU in particular can be a place of high emotion. So again, you have to know yourself. I find that coming to nursing sort of later in life, I do have pretty good communication skills. You have to have difficult conversations at times with patients, when you're giving them a poor prognosis, or maybe the events that brought them to the ICU are going to change the way that they live their life or where they live their life. So you need to be able to talk to families and patients in I think, a kind and compassionate way. That's a good skill set to bring to it. You also deal in the hospital in particular with a wide range of um, peoples of varying levels of education, different job responsibilities, from the housekeeping staff all the way up to the doctors and surgeons that treat a patient. Those are all part of the patient care experience. So when we talk about a multidisciplinary team, it really is, because the people that bring the meal trays into the room can have as much of an impact sometimes as the doctors, depending on, what the path is through the hospital. So being able to talk to lots of different people about lots of different kinds of things is important. And I think experience helps, and people build on those skills as they sit, in whatever career path they're on.
So I'm curious, as you evaluated in 2010 and decided to go a different route, what what drove you there, and also what from your skill set could you take with you?
Sure, sure. So I think I approached, once I decided to retrain, you name a job, I considered it. Yeah, I mean, you can, it's hard to think of a job that I didn't at least think about at that time. The things that drove me, I had worked for myself for, better than 12 years. And so I thought that perhaps I might not be the best 9 to 5 employee. I was used to a lot of independence, I guess is a good way to put that. So the flexibility was a really important thing for me. I love the fact that I work long shifts, I work long hours. Sometimes I work days, sometimes I work nights. But because I work 12 to 14-hour shifts, I only work 3 shifts a week. So I have some time off to myself to plan the rest of my week and the rest of my life. And that's a big advantage. The portability of the degree was also important. Going into nursing, there are hospitals and doctors' offices and lots of places that need nurses everywhere. So that was I think, a big advantage as well. So the portability and the flexibility are the things that sort of brought me to nursing. I kind of knew myself. I thought I wanted to do something that felt important and exciting. And I started the whole process thinking about maybe a paramedic. But then when I looked at the career path, the ability to advance that career and what kind of training, how long the training would take and how expensive it would be relative to the salary that I could make, nursing just sort of made more sense, particularly at the time for me. I guess the things that I bring with it are go back to just sort of life experience and communication skills. Um, I think that's one of the things that sets me apart from some of my peers. Also, I had always been a person who liked to seek other certifications and other sorts of trainings, and there's ample opportunity for that within nursing and certainly in critical care.
When I was even thinking with your construction background, the math and the logistics of building, because with nursing and being a nurse practitioner, you have to put all the pieces together as well.
There is that, yeah. So I think that being able to not lose the forest for the trees, yeah, that's important to be able to put the big pictures together, and be able to prioritize as well. Being a project manager, it's important to know what the next step is. And I think that's also important to figure out in terms of creating a plan for patient care, but also being able to communicate that effectively with the patient and the patient's family so that they can understand where we're going and why we're doing what we're doing.
Exactly.
Yeah.
So if a 16, 17-year-old is watching this and does want to be a nurse and go down that path, what high school classes should they really focus on to get them started, as you said, down that career way?
Yeah. So a focus in health sciences is always a good idea. The basics are biology and chemistry, but taking an anatomy and physics, or I'm sorry, anatomy and physiology class is really important. If there's any sort of microbiology, that would be helpful. Also, any kind of medical terminology would be really beneficial as you go into those classes. So really just sort of a life sciences background would be a good first step.
So all the tools you used and named up at the beginning, they can research and they'll know their past their terminology class when they know what those are, right?
Right, yeah, because it is a different language. Any field that you get into has its own jargon,
Mhm.
and niches within medicine, that can be true as well. If you work on the surgical floor versus neurology versus medical ICU, we all have the things that we talk about all the time and the acronyms for those. So, you'll have to further refine that as you get into the work setting that you're in. But a good medical terminology class will go a long way.
And what would you say for just anyone watching this and looking for advice for their future? What words of wisdom could you share with them today?
Well, just for myself, I guess it's never too late to change. That's one thing. And, the quicker you get started, the quicker you get there. And you don't have to know your final destination. That's another thing. When I first started nursing, the plan was to probably get an advanced degree, but perhaps go into anesthesiology as a nurse. And I also thought that particularly I wanted to have a role in the operating room. But once I got in the operating room and I, worked there for a few shifts and did some clinicals there through my training, I decided that that wasn't really the right place for me. So it's great to be able to try new things, and you don't get to try things until you start. So starting the process, whether that's as an associate degree or, a patient care tech or a med tech or even a radiology tech, those sorts of things, just starting that program so that you're working in the hospital and seeing all the different avenues that you might not be aware of until you're there. I think that's important. That'd be my advice.
All right. Well, thank you so much for your time today.
Oh, absolutely. It's my pleasure. Thank you.